At Studio U, you have a number of different therapists and practitioners. Can you talk about why you have more than just physical therapy at Studio U?
Yeah, it goes back to that continuum of care of where a patient comes from, what they need to do. There are specialties in this world that do what they do, and they're great at what they do, and we all can't do everything. And so we need to kind of find our niche, and when we see that our clients need something else, to get them to that person that can help them is great. So I've incorporated so far at Studio U, I'm hoping to develop even a bigger integrative care type clinic. We have neuromuscular massage therapy. We have personal training. We have straight Pilates without the physical therapist piece. We also are introducing some hours with another group of traditional based therapy, insurance based, for those people who really do have acute injuries and need to be seen. It's part of that whole continuum. So I believe that people need to have access to other places, and we need to refer to other people so that client can get everything that they need.
How do athletes benefit from physical therapy? Is it just after injury, during injury? How can you explain to our athletes out there?
Obviously, athletes benefit from physical therapy for the injury. Athletes can utilize a physical therapist to start to work on building performance, and whatever that requires, performance, so whether it's skill or speed or power or whatever that is. So an athlete could come in, we would evaluate them, figure out what are they lacking, where's their motion not there, is it a tightness, is it a weakness, is it a hypermobility somewhere, flexibility issue, and we would help train them into that and help to train them into their sport. Now that being said, we are not technically coaches. We are not professional pros for golf. We are not that. However, we know movement, and we know what movement needs to happen for those sports. So we will help recreate that movement, help those muscles figure out where they need to go. And then, of course, we'll send them off to their people who really know their skills. And if they get to work on their skills and put all that together.
Awesome. As our consumers and patients learn about physical therapy, to us it feels like there's no substitute for it. Would you agree with that? Is there any other specialty that really competes with physical therapy? Because yoga doesn't seem like it competes. Pilates has its own unique benefits. Would you say that physical therapy is really its own unique therapy?
I would. Once again, a physical therapist looks at a body from a certain way. How is it moving? And is it moving cleanly and efficiently? We have our chiropractors who also look at a body similarly, but we end up working differently. We're actually very, very complementary. Oftentimes, I will have a client see a chiropractor so they can get the bones moving a little bit better and let that movement happen, and then they're back to me, and so I can help train that new movement pattern. When you move into the yoga and Pilates world, you're absolutely training those patterns. However, it's more of a generalized training. So it's a great transition to, in your own world, to play with it, because money is a factor, and you need ways to play in your own place. And if you love yoga and if you love Pilates, well, let's teach you how to be safe there, and then you can go play there. Personal training, same thing. They will look at movement and all that too, but once again, not to the same degree that a physical therapist can. So they might see you have a weakness in your glute. We'll see that, well, your hip doesn't move, your hip capsule is too tight. We need to stretch it and open it and do this, and that is not within their realm. So they send people on. So yeah, physical therapy does have its own niche for sure.
Awesome. Can you explain it as a physical therapist to our consumers out there? What is the difference between good pain or bad pain post-workout?
All right, good question. Pain in general with a workout. Let's start with during the workout. If you feel anything sharp and shooting or a very specific pain, that is a bad pain. And that's true for during, after, before. That's a bad pain. You never want to have that. That's more of a joint type issue, a deeper issue. Now, a little soreness and tightness in muscles you've used, normal. That being said, if you feel completely wasted after a workout, you probably worked too hard. The muscle recovery should be within a couple hours. You should still feel pretty darn good. If you're feeling a lot of pain within a couple hours, too hard of a workout. Next morning, you might feel a little sore. That's normal. That's delayed muscle soreness, and that's normal. Sometimes up to 48 hours, not a bad thing. Now, if you're still feeling this a week later, once again, that's a bad pain. You overworked. If you're feeling muscle soreness and pain, you're going to want to rest if you can. You might want to take a casual walk or something like that, get some movement, but not like a workout, a hard workout, more of a let me get my blood flowing to see if you can kind of clean out some of the junk that's hanging out in the muscles and get rid of that. But you don't want to force yourself to keep using that tired muscle, even though it's not a bad pain. If you keep using it, you could injure it.
For our consumers, can you cover some of the top reasons that they should come to see a physical therapist?
The top reason would be you don't feel good in your own body. That's probably the main reason, whatever that is, whether it's a pain, a stiffness, I don't move very well anymore. I don't understand why it takes me so long to get out of a chair. I can't go up the stairs. I need to reach in to grab my grandchild out of the crib. I need, when I'm cooking or doing dishes, I feel a lot of upper back pain. I sit all day at work and wow, I get really tight in my neck. So really anything that just doesn't feel normal that you're starting to notice is catching up with you. And a lot of times, some of these vague feelings, we might take them into our doc and sometimes it gets discredited as you're just aging. I don't buy that. We need to keep yes, aging happens. However, if we can keep our muscles moving and limber and our joints moving where they need to do, we can fight aging to a point and keep you moving, yeah. Just want people to feel good in their bodies in whatever mode that is. If it's not physical therapy, that's fine. But whatever that is, you should feel good in your body.